One of the creepiest patients I've ever had in my entire life.
So, if you've ever worked in the ER, you might have a story like this. We had a patient come in. She was probably like a middle-aged woman. She was very tiny frame, and police officers brought her in because she was like a Baker Act and needed medical attention. It wasn't my patient. It was my friend's patient. And I was just kind of like helping her on the side because we all just help each other with patients if we're available. So this lady was like, it was like she was changing personalities. She would like talk in one voice and then talk in another voice and have like a different demeanor. It was almost like her face mutated with each character. It was super creepy. Some people were just like, oh, it's schizophrenia, she's on bath salts. But the creepy, scary, ominous feeling when you were around her was like, oh no, there's something maybe beyond the physical happening. She chewed through her restraints. She was like eating things that were not edible, like in the room, like plastic, and she ripped apart the sharps box off the wall and tried to eat the sharps. It was the most terrifying thing I've ever seen. I don't think it was bath salts. I don't think it was schizophrenia. I think it was something else. I don't know.